Hi, this is Dr. Sampson Davis, and I'm back with my health and survival plan for you. I'm here today to talk about a very serious matter that has been very popular in the news as of late. I'm here to discuss sexual assault. You may have heard about the young man from Stanford University who was sentenced to 6 months, only 6 months in prison for a sexual assault that took place on a college campus. Now, it goes without saying, you know where I stand with this. This is totally against the law. He should be thrown underneath the cell. Morally, ethically, you name it, medically, is all wrong in so many ways. Unfortunately, the statistics shows that 1 in 4 women would be assaulted sexually once in their life. And for men, it's 1 in 75. And although the numbers are larger for women and smaller for men, we see that most of the assaults for men happen before they're 13 years old. I mean, this is just a crying shame and something that we see happen in our country far too often, and more has to be done. Now, if you do come to the emergency department for a sexual assault, we have to go through what we call a examination, in which it's both a medical legal process. The authorities usually show up with a rape kit, or what we call a sexual assault kit, and they have to be present because we have to make sure that they see the DNA that is collected go from the person who's been assaulted into the hands of the police officer to the lab to be tested. And so your clothes, the person who's been victimized here, clothes is taken from them to check for DNA. Hair fibers are collected. Any scrapings from underneath the nail is collected. We do a genital examination for women. We use a probe here, which is called a speculum, to collect any sort of secretions, semen. Also check for bacteria, sexual transmitted infections such as gonorrhea, chlamydia. We also check for HIV, and pregnancy. We offer the morning after pill just in case if there was some ejaculate that went inside the person, to make sure that they are tested and preventing any unwanted pregnancies. That material is then collected, sent off to the lab for further testing. I remember being a resident working in the ER, and we had a 16-year-old patient come in who was assaulted by a neighbor, and she was brutally raped. And I just remember her crying and bleeding, and I had to examine her, and I felt so bad for her. At the same time, I felt my presence reminding her of the assailant that attacked her, because it was a guy that attacked her. Here I was, a guy, performing the examination, and I felt so horrible for her. And I just imagined if this was somebody who was related to me, what I would want to do to the person who did that to her. I would want to kill this person, and really bring physical harm, because that's the rage that you feel within yourself, knowing that I couldn't do that, obviously, but at the same time, it brings you to that point of just reacting in a way that is just something that you can't even predict how you would react. So, looking at it in this type of way, this is something that is far too common, that's unfolding in our country. And obviously, this young man from Stanford University should be thrown underneath the cell, and he should be, not given a second chance, because he knows better. And college is a place where you send your kids to be safe. It's a safe zone, and to see sexual assault so prevalent, especially in college campuses, is something that's is mind-boggling. So I think we have to talk about it more as a nation. You need to take action. I want to hear your thoughts. Make sure you inbox me and let me know what your thoughts are, especially on this young man from Stanford, and what are you doing to keep your children safe.